I'm Daniel Powell.
Patrick Powell.
Ashton Stevens.
Becca Johnson.
Jerry Goodman.
I'm Troy Gray.
Okay, so thank you for coming. For the past 4 weeks, we've been working as the doctors of Georgia and Robert Flanagan because they have been wanting to get pregnant, but it so far has not been working. We did a whole bunch of research about the different causes of infertility and all the things with that, and we are very happy to share it with you here today. So here is Jerry and Ashton's video with Robert.
I'm just here to ask a couple questions. Okay. Tell me some basic things about yourself.
My name is Robert Flanagan. I am 48 years old, 6 foot and 1 inch, and 190 pounds.
Okay, what's your profession?
For a good 25 years, I worked in the oil field, and I was kind of off and on working in the rodeos. And for this past 3 years, I've been a student at Casper College, getting my degree in business, and that's actually where I met my wife, Georgia, was in a psychology class.
You ever had any children?
No.
Boxers or briefs?
Why would you want to know something like that?
Well, the ideal body temperature is too high for the testicles to produce sperm, right? So they need to hang a little lower so that they're a couple degrees lower than core body temperature. In the briefs, they rise it back up in turn rising the temperature, which can result in funny semen or low sperm cell counts.
Okay. Yeah, I have to wear briefs because I like to wear Wranglers all the time.
Okay, do you smoke cigarettes?
No. But I often like to chew.
Do you drink regularly?
Yeah, I like to drink a couple beers at night. Blue Ribbon, you know.
Have you ever done any hard drugs?
I suppose in my early 20s, I did marijuana for a couple months, but I quickly got over that.
Okay. Well, here in your record, it shows me that you were in a motorcycle accident a couple years ago.
Yeah.
Do you mind explaining what happened?
I was in my early 30s, and as I was coming over the handlebars, I caught my junk in the handlebar, and it took me a while to get back up from that.
Have you ever experienced any other broken injuries?
Yeah, for 4 years in high school, I did rodeo a bunch, and working with some of those bucking broncos, you know, you get a lot of injuries to the groin.
Okay. Have you ever had any signs of erectile dysfunction?
No. I'm clean of that.
Okay. How many sexual partners have you had?
I've had a lot of sexual partners. Too many to remember.
Okay. How long have you and Georgia been having intercourse?
George and I, we've been hitting it up pretty good, 3 to 4 times a week for the past 3 years.
Do you regularly use condoms?
For 30 years I used condoms, but for this last 18 months, since George and I have been trying to have a baby, I haven't been using condoms.
Okay. Have you ever been tested for any STDs?
Depending on what's an STD.
A sexually transmitted disease.
No.
Have you ever had a semen analysis?
Not that I know of, no.
Well, what we might do is we might have you test for a couple of STDs, just more common ones, and we'll probably do a semen analysis as well.
Okay.
Okay. And that's it for today. Thank you. We'll see you next week. Dr. Ray, can you tell me a little about yourself?
My name is Georgia Flanagan. I am 21 years old and I've been married for the last 3 years and I'm currently attending Casper College as a full-time student studying psychology.
Why exactly are you living in Ontario?
Well, for the last 18 months, my husband Robert and I have been trying to get pregnant and so far I've been unsuccessful.
I see. Well, let's start. Would you mind giving me your height and weight?
I am 5 feet and 6 inches tall and I weigh 135 pounds.
Okay. How would you describe your diet?
We eat okay. Being full-time college students, it's sometimes hard to eat a good meal for lunch, so we sometimes go out, but for dinner every night we try to have a nice home-cooked meal.
Okay. Being a college student, are you usually stressed?
Yeah, I stress over tests quite a bit, and lately I've been pretty worried about this. I really have always wanted to have a family. This is making it seem like that's not very possible anymore.
Do you and your husband work out?
Yeah, we go to the gym about 3 or 4 times a week. We have memberships at the rec center.
How would you describe
About 3 or 4 times a week.
Have you ever been on any birth control in the past?
Yeah, when I was 17, I was put on it, and I stayed on it until I was 20 when we decided to start trying for children.
Well, the reason I ask is normally it takes about 4 months, birth control, 4 months to get out of your system. And there have been some cases where it's taken a little bit longer. Is there anything in your sexual past that you should be aware of?
Yeah, I had chlamydia. I was given it by my first partner.
Okay. How did you discover this?
After a while, I started to experience some lower back pains, and I talked to a few friends about it, and they said I should get, if it didn't go away, I should get it checked out. After about a week or so, it was still there, so I went and got tested, and I came up positive for chlamydia, sadly, and negative for gonorrhea and syphilis.
Did they give you any medications for it?
Yeah, I took some antibiotics and it was gone within the next week or so. It's pretty quick.
Okay. Do you know about how long cumulative the chlamydia was in your body?
Probably a little bit over 2 months.
Have you ever been tested to see if it caused any damage to your reproductive system?
No, I have not.
Do you have any history of infertility in your family?
No, not that I'm aware of.
Well, we might do a couple of tests to see if your reproductive system's damaged. Other than that, I think we're good.
Alright, thank you.
Running off of those, I'm going to try to explain to you guys how the two reproductive systems work, and I can try to explain to you how asking those questions that we did would help us figure out a little bit more about what could be causing their inability to have children. So we're going to start with the male reproductive system, and it starts at the testicles, where sperm is created. And on the back side of each testicle, there is the epididymis, which is basically a convoluted series of tubes and pipes, and I'll explain a little bit more about those later. But this is kind of the track of the male reproductive system. The vas deferens, which comes off of the epididymis on the back of the testicles, goes up into the body, and it travels next to the bladder. And after it gets past the bladder, there's the, I always mess this one up, the seminal vesicle. And from there, it's at this point where it is the ejaculatory duct, where the vas deferens then becomes the urethra. And then just after the ejaculatory duct, there is, maybe I should fix this. The prostate gland, which will tense up and change the flow of urine and semen through the urethra. And after the prostate gland, there is the Cowper's gland. I'll be able to explain more about that. And after all of these fun little glands and all that, we actually get to the penis, where the semen is then carried out. Now, the reason for all of this is because the testicles produce sperm at a rate of about 60,000 per minute, and they are matured in the epididymis on the back of the testicles for about a month, 2.5 months. And during ejaculation, there are muscles that will tense up and shoot the sperm through the vas deferens. When it gets the seminal vesicle, it adds fluids such as enzymes and enzymes and fructose sugar to feed the sperm to keep them moving. And before it even gets here, the Cowper's gland releases some fluid that will that'll change the pH levels, because the penis is primarily used for urination, and urine has a high pH level, which is too much for the sperm to handle. So the Cowper's gland releases fluids that will wash out and change the pH level, so the sperm can actually continue to live. And then it goes out and through the end of the penis. Now, in order to make intercourse easier, we have the corpus cavernosa, which I'll explain a little bit more in this. You're gonna have to breathe with me here. It's a cutoff diagram. We'll just leave it at that. And say if this was the penis, maybe a little bit rounder. There are 3 main sections in here. Right here is the urethra, and there are muscles right here that will actually contract out or expand, or I think contract is the right word, but it will allow the urethra to continue use as the corpus cavernosa fill up with blood to make the penis erect and make intercourse a little bit easier. Now, all of this is here just to create this, and this is a sperm cell. Now, these are just a few, sperm cells aren't too complex, but they do have a little bit more to them than this. The tail is used to swim through the body or up to the fallopian tubes after ejaculation. Now, the nucleus contains the nucleolus, which carries the male's 23 chromosomes, and the acrosome carries an enzyme that will break down the outer shell, or the corona radiata, of the female egg to allow fertilization. And the creation of a sperm cell, we'll go back even farther, all starts with the spermatogamy. No pun intended. And there's 46 single chromosomes. And then there's replication, which will create a different group, which will have 46 sister chromatids, which are literally just copies of the chromosomes. And from there, through the first stage, through the first of the 2 stages of meiosis, it will split into 2 groups with 23 and 23 sister chromatids. And then it will go through one more phase where it will produce the actual sperm cell with the 23 chromosomes, again carried in the nucleolus to the ovum, which is where the baby will get the father's half. And from there, we're going to move to the female reproductive system. And Ashton's going to start by giving you a little bit about the ovum.
With the egg, I will start by saying some facts you would like to know. The egg is, the female egg is the only egg, I'll start off with, that is perfectly spherical in shape. Now, it's also the only egg, the only cell in the body that is visible by the human eye. It's a 1/10 of a millimeter in size, which if you put in perspective, which is about the size of a grain of sand. Now, in a baby that's 4.5 months after fertilization, it will have all its eggs, which is 400,000 eggs inside the newborn baby. After the puberty years of the girl to her death, she'll only use 480 of those eggs, and the rest will all die off. I'm going to start off with the Corona radiata. Sorry, I'm not good with Latin. Radiata. I'm not good with Latin. Its basic function is to nourish and protect the egg from invaders. And the zona pallidicida is basically it's the closest thing to a shell that the egg will actually have. And it's a mixture of sugars and proteins, which will act as a magnetic field, which will invite specific sperm that the egg likes and will repel all the other sperms that will appear as an alien to the egg. And then the cytoplasm we have, which is basically a self-contained universe. So this cytoplasm has everything the eggs needs to survive, with all of its information and everything that will, in the end become the baby. And then we have our nucleus, which when the sperm makes its way all the way in, the nucleus holds the mother's information. And when the sperm comes in, it will come in here, and then the DNA will combine and begin to multiply, making the baby. And that's a basic overview of what the egg is.
And we're gonna start. I'm gonna start the female reproductive system with what happens to get this egg ready to be fertilized. Is pretend that this little deal down here is like the side of an ovary, and it starts down here where it starts out pretty tiny. It's the only cell in the human body that is actually visible to the naked human eye. It's about the size of a grain of sand. From there, the follicle, which is the area where the ovum is stored, will expand with enzymes, and Patrick and Jerry will blow you away with that one later with the menstrual cycle. It'll slowly get bigger and bigger until eventually, this marker's not very good, until eventually the follicle will burst, and it will allow the ova to escape, and then the follicle will kind of repair itself and just look like a shriveled heap that slowly shrinks. But from there, ovary, and we just have the bursted follicle right there. The fimbriated ends of the fallopian tubes will catch that ovum and carry it to the uterus, which I might have to get into that later, which has prepared itself with a uterine lining called the endometrium. Yeah, the endometrium. And we're just going to say for this first go around that the egg does not get fertilized. The sperm, after being ejaculated into the vaginal canal, didn't make it. Here's the cervix. Just think about this area, and right here is the vaginal canal. But let's just say, after the fallopian tube has caught the egg, and it has made its way through, and all the sperm failed. What happens is the egg will fall into here, and the endometrium will be like, all right, this didn't work this time around. All systems go. And it basically flushes out that endometrium and the ovum, and this is the 1 week of hell that women go through during their menstrual cycle. And it flushes that all out through blood. Now, on this side, we're going to say that after the follicle is burst and the fallopian tubes have caught the ovum, the sperm make it, and they successfully fertilize the egg. What happens is it'll drop into the uterus, it'll attach to the uterine lining, where it will grow from there, and the uterus will become the womb and nourish the baby until birth. Seems simple as that. If that even qualifies as simple.
Alright. So now we're up to me. I'm going to just briefly describe that whole 28-day cycle, the menstrual cycle. And then Jerry will take you through hormones. So bear with me a little, because I'm bad with words. At least I feel like I am. And I'm also very bad with boards. So this itself, just for your circle, is your 28 days from 1 to 28, circling right back around. Divide into 3. Probably I'll divide that into 4, actually. Might work better. And you basically have your 4 different parts of it. It's divided into 4 neat little weeks here. We have the first one. This is menstruation. During that first little chunk here is where the uterine lining that was explained here is more or less getting out. This is, you're bleeding the week of hell, as you described it. And somewhere around towards this general area, we get, this chunk here is the uterine wall starting to, or the lining starting to thicken again. Just kind of developing itself again. More or less preparing for the ova to get back there and such. Then somewhere around here, around your 14th day, begins ovulation. Actually, gonna write those up here for you. So first. And right around here, day 14, ovulation. Somebody help me spell it.
Just call it
O-V-U-L-A. Shun, T-I-O-N.
Thank you, Daniel. But this is the time where the eggs are developing, coming from the ovary, going through the fallopian tubes, or at least roughly around that area, I believe. This is around this time is basically where the best chances of getting pregnant, but just shortly before it and a little after it. And just after, we have up to around here, this general area is your, do not recall the actual name. This is where the corpus luteum would be dying off, which I don't believe we explained and don't know how to explain.
That would be the endometrium, the uterine lining, which is dying off.
Yes.
Which starts the menstruation at the beginning of the next cycle.
Yeah. Dying off and then begins right back there. That, of course, the corpus luteum thing, I'm pretty sure that's only if the does not get fertilized, if the egg does not get fertilized. Yes. Well, that's about all I got. Very. That there.
And here we have our 4 main hormones, which is estradiol, progesterone. Those are our first 2. Estradiol, you can see that it is there throughout the whole cycle, but spikes through ovulation. And yeah. Scroll down. And then progesterone is low through the first couple weeks and then is higher through the next menstrual cycle, which is about 14th day through 30th day about. And then you have the luteinizing hormone, which is low through the first week and low partially through the second week, and then spikes through in between the second and third week, and then goes back down. And then the follicle stimulating hormone, FSH, is high going into the first week and then drops and then spikes again during ovulation and then dies off again. And that is basically your hormones.
And after that, we felt it was best to turn to Robert's semen analysis, which will be passing the results out.
Now keep in mind that Robert's semen Robert's problem was he had drug use. Bike accident,
Bull riding.
the briefs and Wranglers. I think those are the biggest ones.
Basically, what we're looking for is any anything wrong with his sperm or semen, and
Any deficiencies, abnormalities.
yeah, and the appearance of his was gray and
Clear.
clear, pretty much, and then that's pretty normal, not really that much wrong with that. The volume was 5 milliliters, which is pretty good. And his sperm cell count was 55 million per milliliter, which is actually pretty good because we're looking usually it's around 50 to 60 million per milliliter, so that's actually pretty good.
And his viscosity is basically how long it takes to get from a thickness to a thinness, like honey and water, I suppose. He came out with a +1, which means it can go from thick to thin in about 10 minutes, which is very good. It helps with mobility and the speed that the sperm is able to move towards the fallopian tubes. A +4 is bad because it means it would take about 30 minutes. The mobility is the ability to move. You want to have more than 40% on that. Or they also sometimes grade it by A, B, C, or D. A is moving forward quickly, B is moving forward slowly, C is where they just wiggle but they don't actually move, and D is where they don't move at all. So he had a very good mobility and forward progress. Sperm morphology is whether it looks like an actual sperm. It's got a good oval head, nice tail. It should be about 14 to 40% if you want to be very strict about it. If you're not very strict, then just more than 60%. Robert is either too low or too high. Actually he was just right, wasn't he? Nope, too low or too high, depending on. Well, he got 80%, 11% was abnormal, and then 80-something was normal. So he was either too high by strict standards or just right by, hey, non-strict. And then we're moving on to, so in conclusion, we figured it was Georgia's, who was, and I can't find the word. Yeah. So, as stated in her interview, she did have chlamydia for about 2+ months, and I get. Oh.
Next time you
Okay.
play it, you're going to be able to, at the bottom, hit pause, or you can be able to click on it. I think you'll be all right.
Okay, well,
You just-
anyway, in thoughts
Real
to
quick
that,
down
we
there. There you go.
wondered, we assumed that possible clubbing could have happened to it. But, clubbing is, here, I'll get it. Looks, we guess, similar to this. It starts, and as you can see, it got kind of like a rash, I suppose, very spot. It started expanding and getting red. She was bilateral, so both fallopian tubes were harmed in this. To confirm our findings, we did a dye test. We had her lay down on an X-ray table, put a tube up to get past the cervix, which clenches said to keep stuff from vagina to uterus, and released it into uterus so that it could flow, showing us whether it got through or not. We had to, till we get through, she had to wiggle a bit, but we did confirm that there was clubbing, bilateral clubbing of the fallopian tubes. And
Here's a fact from one of the medical websites I visited during this problem. It says chlamydia, when left untreated, can damage the uterine wall and fallopian tubes and cause scarring, causing clubbing, ectopic pregnancy, and infertility.
Okay, so we discovered a few different ways we could treat the clubbing, and she said I want a boy. One of the ways is through in vitro, which can be shown through this video that we had watched. It's a National Geographic video. It has a couple who had the process done, and it just kind of shows this, and it begins where they're taking the eggs out of the mother.
Sure, on the left side, there's a lot of follicles. You can see the needle tip there on the spring.
The remarkable egg that begins human life is a single cell, no wider than a hair, barely visible to the eye.
Most people have no idea how small a cell is. If I crudely scrape the inside of my mouth, I have about 10,000 cells under my fingertip. These things are really small. You can't see that without a microscope. And yet that can make a human. See how amazing this is?
One by one, 27 precious eggs are retrieved. When the safety of the eggs is assured, Daryl's semen is collected. Embryologist Bob Prosser will filter out the dead and less healthy sperm.
Okay, this is the before sample. It has not been processed. And so from this, we can compare this with the post-processing sample. You can see that the sample is much cleaner. Almost all of the sperm are motile. And they look like happy campers.
Dr. Prosser positions the egg, magnified 400 times, and readies the single sperm he has selected from a pool of hundreds. The sperm is injected, and the critical moment for fertilization arrives. Like a great celestial director, he repeats the procedure, guiding sperm to another egg.
Alright, that's is they fertilize the egg outside of the body, and then they take that once it starts to develop, and they know it's going to develop right, they place that inside of the uterus and completely skip the rest of the process. And this is pretty good because whenever the clubbing happens in the tubes, it raises the chance for infertility, but it also raises the chance to have a tubular pregnancy, which means instead of the egg developing in the uterus and growing into a baby there, it'll end up, most likely, it's very rare for it to happen anywhere else, but it's very likely for it to happen in the fallopian tubes, and the baby starts to grow there. And that can be very painful for the mother if it can cause problems, and it can cause the fallopian tubes to burst, which is very harmful, very painful, very dangerous, could kill her possibly, yeah. But with this, it completely skips that, and it erases the chances of that even happening. Another possible treatment that there is it's fallopian tube recanalization, and it starts, her tubes are blocked like we showed earlier, and then they place a tube up through the vaginal canal into the cervix, and then they place a flexible cord through that and aim it towards the fallopian tubes and push it through, and it will start to push out some of the debris and things that are causing problems. And then they push, or they put dye through the tube up into the fallopian tube, and then that then pushes out some of the debris and can help. And then a lot of times after that, the woman will be able to get pregnant from that. Another way is through, it's completely natural. You can do it, you just massage on your body where your fallopian tubes are, and when you have the problem, when you start massaging, you'll feel the pain from it, where you'll feel discomfort and some pain, and that's where you need to have things worked with. But you just massage around. They usually say to leave it alone once you do that. And most places you can get, like online, you can get a video that'll teach you how to do it properly so you don't hurt yourself even further. But then once you do that, you'll start to take some natural herbal remedies and things like that. You will have to, it'll help to take some capsules that have organic ingredients to help flush out your body, because you need to flush out all the toxins in it, and to take some nutritional supplements to make sure your body is strong and it can help get rid of the problems. And one good thing about this is it can completely avoid any type of surgery or like anything where they go in your body, because like the other one, it's not very invasive, but they still they end up going into you, and it's kind of, some people have problems with that, and some people have had issues with that happening where they get infection or things like that, and it completely avoids that. But some people would prefer to have the surgeries done because it can have a higher chance of actually working. So, and those are our recommendations, and now we will be happy to answer any questions for you that you might have.
Maybe the group just go ahead and pull up some chairs at the table.
I have a question. Go ahead. Okay. Well, back to the charts that you had on hormones and stuff.
Yep.
I don't quite understand what those hormones do specifically.
Follicle stimulating hormone.
Why don't we just do like that chart that we had up here before?
Oh.
Anyway, keep explaining.
Oh, the follicle stimulating hormone it stimulates the follicles that Daniel was talking about earlier that help produce the egg, I believe.
There's the follicle stimulating hormone, which is injected or is created. The pituitary gland of the brain is what controls the hormones and all that, and it will tell the Grapharian follicle in the ovary to start secreting the FSH to make it available to start filling with enzymes and different other hormones. But
And here, do you want to pull up those charts?
Progesterone
Yeah, there's progesterone
and LH.
and LH. Progesterone. Progesterone. Who did progesterone? Did we do progesterone?
we did progesterone.
Okay.
Take a look where it's really spiking in terms of the days of the cycle, and see if that will help you come to some conclusions about that hormone.
It starts spiking around day 22. Well, it spikes at day 22 about. And there is where the uterine lining is starting to flush out through the vagina. So it is basically telling the uterine lining that it's not needed anymore, and that it needs to be flushed out through the body. And then LH, the luteinizing hormone.
The follicle stimulating hormone will actually spike at day 14 or to cause ovulation, because it's that spike of follicle stimulating hormone that will actually cause the follicle and the ovary to burst.
How about that top one? Can you scroll us up real quickly? Yeah.
Estradiol.
Anybody want to take a stab at that one?
It's that one.
I don't think we did that one.
I did, but I completely went over my head.
And Brittany, estradiol sounds a lot like.
Estrogen?
Yeah. So what will estrogen be responsible for, through the cycle or just throughout a woman's reproductive years?
Like I said, the hormones kind of went over my head.
Mm-hmm.
And these were all just the woman's hormones, correct?
Yes.
Yeah, the ones
But,
in the
like-
menstrual cycle.
Yeah.
Some of the same hormones are also produced in males too, but perform a different purpose.
It's kind of been cool to learn about.
Yeah, like I didn't get much into the male one because it was working on the female. So some of the female, like I can remember, like I remember some of the progesterone was kind of like it went with the egg to kind of protect inertia as it was going through the fallopian tubes. And I remember that was kind of the nursing for the egg.
I just had another question. What is ectoscopic pregnancy?
Ectopic pregnancy is where the egg is fertilized in the fallopian tube but doesn't necessarily make it to the uterus, and actually the baby will begin to grow in the fallopian tube.
What
But you
else?
don't want that.
Yeah, alright.
Is there a remedy for that?
No, there's no way to fix it after that. It's pretty much done.
Alright.
When you say it is done, what do you mean, Becca?
The pregnancy, it has to be removed immediately because it can potentially kill
even if they catch it like within a day of fertilization, they can't like take the cell and move it into the uterus where it can actually grow normally.
What are the chances of it being caught in a day?
I don't know.
It's when the baby starts to grow that it actually causes pain, and that's one of the things that they check for is ectopic pregnancy, and if they see it, they don't even mess with it, they get rid of it.
You have a question?
The chlamydia seemed to be her problem. How would it have affected him if he was the one with chlamydia? Does that affect his ability to reproduce?
Georgia had a previous boyfriend who she got the chlamydia from, and within 2 months she had it treated and got rid of it, so there's no chance that Robert has it.
But if it
But
had
if
been,
it was Robert, then what?
You can say it.
I think what happened is it ends up damaging the testicles.
Well, it causes problems in the
Epididymis, which
Yeah,
is
the tubes on the
basically the
back.
sperm nursery.
It's all this back here that will cause all the sperm to mature.
it messes with that and they can't mature, so then he pretty much becomes infertile. I'm not sure exactly which one.
And chlamydia can also cause problems with the egg once it's actually in the fallopian tubes, because you know how he was talking about how it'll attract some sperm and it'll tell all the sperm to go away. It'll cause it to be unable to do that, which doesn't help at all because sperm, much like its creator, doesn't have much of a sense of direction, so it's going to need
it
that
follows a
lead.
scent given by the egg and the body heat of the fallopian tubes and such, so it has heat sensors and a nose. That's so crazy.
and I have another question that's probably kind of naive, but when this splits into 23 and 23, and is that the male and female thing? I mean, are those male sperms and those are female sperms?
No, it kind of just happens. It I don't know, just kind of decides whatever it wants to be. It's just that the chromosomes, the chromatids break or split and copy themselves over and over again, and that's what allows guys to create 60,000 a minute.
What about in the egg? Does it have 23 too? Because I think it takes.
It does. It takes 23 and 23, and that's why the cells, it goes through another meiosis phase to turn back into chromosomes, because chromatids aren't going to do anything. So it's the 23 chromosomes in the ovum, 23 chromosomes in the sperm cell that will come together to create a human being.
So, how many other different problems did you guys talk about? I'm really curious as to what else could possibly have gone wrong that.
Unfimbriated ends of the fallopian tubes, which is I gotta draw my fallopian tube again, but I'll just draw it over here.
Or could you back up, bring up the picture up?
Here, no, just put mine.
Yeah.
Oh yeah. Did you guys make those illustrations with the and that thing?
Well, this portion, that is
The main picture? No.
the main picture. No, but I added in the clubbing portion, and I moved the fallopian tubes, and that's
And the
not the
tube and the
original
wire
picture.
she also created, and she put in a video to act as an animation.
But the unfimbriated end of the fallopian tube is basically the end. Instead of looking like a hand, that will basically they fluctuate. They tend. What is a tend?
Okay, here you go.
They do this. They move like this, and that's what will suck the ovum into the fallopian tube to get fertilized. And some very unfortunate few people get born with this unfimbriated end, and basically what happens is once they diagnose it, the doctor does a bimanual abdominal examination of the vagina and anus, and after he checks to make sure that everything, at least in those two areas, are fine, what he does is, say this is like, it's a woman's belly button, right? He makes an incision right there, and he will go in and he will go in with micro scissors and a micro soldering iron. Basically, it's just a needle that burns, and he'll cut away what he needs to without damaging the woman or her reproductive system to get to the unfibrillated end, and he will take the micro scissors and he will split the end of the fallopian tube and peel them all back. And as the stitches that are used dissolve, the fibrillated ends will come back and surround the ovary.
Who decided what her problem was? Was that something that was already scripted, or?
We got the thing from a case study that was done on a couple, and it was just changed, or like the names were changed and things like that. But our tutor had a list of everything that was done and all these different tests that were done, and we asked for the results of that test on their fallopian tubes, and that's kind of how we discovered that.
It was through the research and looking at all the different possibilities that we concluded that it was the 2 months that Georgia had chlamydia that damaged her fallopian tubes and caused clotting.
So did she get pregnant?
No.
Never.
Not that we know of. We don't really know what happened. Do you know what happened?
Mhm.
Did she?
They did. They had 2 children before all was said and done. But will not let you know the method that was used, the treatment, because you all have not yet made recommendations on which treatments you would like to start with.
Will you tell us afterwards?
Sure. Maybe piggyback one question off of what was just asked, and Brittany, and I'm thinking Becca, can you recall the name of the test that involves the dye trying to work its way through those fallopian tubes?
The HGC test or something like that?
Okay? Which is, yeah.
Very long.
Okay. You sure can, but why did you all decide there's countless tests that could be done with him and with her? Maybe you as a group could sound off a little bit more on why you decided to do the tests that you did do.
Hysterosalpingogram.
Excellent.
Hysterosalpingogram?
Whatever you just said.
Here's the different tests we had to come up with.
And how did you get to this point? Why did you all of a sudden say, we better be checking out those fallopian tubes?
The chlamydia.
Yeah.
There was no damage to the uterine wall, but 2 months of chlamydia, thought we might as well check.
Okay.
We came to the conclusion that the HSG test would be a good one because the laparoscopic one was pretty expensive. The ultrasound was possibly pretty cheap, but the HSG test was pretty much right in the middle, and it seemed like it would be thorough enough to give a good result and not really just.
And a single HSG test will test for 2 things. It'll test for scarring of the fallopian tubes and also test for fallopian tube clogging or no, not clubbing. No. Lack of flow in the fallopian tubes. Blockage, yeah. What happens is once they use the wire and put the dye up in the fallopian tube, if the dye doesn't escape, that means there's blockage. If the dye does escape, it also shows scars. If there is absolutely nothing wrong with the fallopian tube, then it will just flow out.
Can I throw a quick question at you, Troy? Because we haven't heard much from you in this Q&A. But Daniel put up 4 different red flags after the interview that took place with our husband, Robert. He's got drug use, he's got bull riding, he's got the motorcycle accident, he's got the briefs, and wearing the Wranglers. It seems like the most important of all red flags is missing from that list, Troy. What might it be concerning Robert? And if you need to, lean on Jerry. And if Jerry needs to, you can lean on Ashton. But I want to hear a little bit more from you 3. What do we know is the biggest oh dear about Robert? Please.
One of the things that I researched when I was looking through his red flags was he said that he worked on the oil field for like a good 25 years, and some like the bentonite and the inverted mud and stuff, when it can soak into your skin and in turn mess up your testicles, and like I'm not sure exactly like how it messes them up, but I did figure out that working on oil fields and mining, like those are the 2 big ones. Like there's lots of people that have gone to the infertility doctors. Most of them, like I can't remember the percentage, but they were either oil field or mine workers. So
Wasn't it like 1 out of every 10 people have infertility problems?
Yeah.
Who work in mines or just in overall?
Overall. Yeah.
And then holding hands with the bentonite and the inverted mud, eating, a guy eating tons of fruit and vegetables with pesticides on them will also causes junk to not work right.
Okay. Ashton, what is the age of Robert?
48.
48. Would a 48-year-old have a greater chance of infertility? Can you run with that at all, Ashton?
Sorry, my throat's kind of messed up today. So from what I got was 48 is older. I would say that it might be less chance of getting it done, fertilized.
Okay.
In my thought. But my biggest thing that was bothering me was he had many partners, and so I was thinking that could be a big problem in being fertile and then using condoms for like 30 years.
I just thought of something. Did you ever get a prostate exam?
Did you all ask for one?
I don't think we did. Because I did read about it's something called retrograde ejaculation, which is where the prostate gland actually doesn't work right, and it will flex in some of the wrong spots. Like, for example, maybe if I change this a little bit right here, say they connected right here and went on, it would close this up, and it would cause some or all of the semen to go up into the bladder, and that would cause cloudy urine. That's one sign of it. But it also eliminates a lot of the sperm, because actual semen is only 10% sperm. The rest of it is enzymes and fructose and these nutrients and chemicals to make sure the pH isn't too high or too low. Yeah. And that can be checked, that can possibly be examined by, yeah.
What kind of a procedure would it be to check that? And you've got prices up here for pricing on that as well.
It costs, for general pricing on
a prostate exam to
I
check that out.
haven't checked the prices of a prostate exam, but I did, while researching this, researching retrograde ejaculation, It takes a few weeks of observation. After every ejaculation you have through intercourse or masturbation, you need to observe your urine as it flows on the toilet, and see if it's cloudy. If it is cloudy, then you have at least some percentage of retrograde ejaculation. There's no way around it. You do. And then after the few weeks of observation, I think there is just the prostate exam. There's probably a little more to it, but and as we all know, prostate exams are pretty standard. Prostate exams?
Not a male.
Should we say what our recommendations are? Please.
If we'll start with you and we can finish over there with Jerry, or excuse me, we'll finish with Patrick. Go ahead, Becca.
Personally, I would go with the in vitro. I think that would be a good way to avoid any possibility of the tubular pregnancy in that way, and I think that would be safer in the long run.
I personally like the physical therapy because it's painless. It's not very high priced, but it has a 66% chance of passing, and that's what I'd give for mine because it's not the high priced, it's painless, and it's not about but maybe 2 months therapy.
And that's when they massage?
Yeah, that's when they massage. Do it from the outside instead of having to go in.
Me, I don't know. I'd probably go with where they take the egg out and then inseminate it themselves.
In vitro.
Yeah. That thing.
I would suggest either A, in vitro, or B, a surrogate mother, if they felt that was an option.
I'm more inclined towards in vitro, if only because I like success stories I keep reading.
Yeah, I'd go with in vitro.
What do you think, Patrick?
I'm actually kind of torn between the physical therapy and the in vitro thing.
Another thing about the couples in vitro on the film was that they collected how many egg cells? 27, 28?
27, but only like
They only used
5
like
were mature enough,
5.
and they put
Yeah.
like 3 in there, and she ended up having twins.
Because in vitro gives you a very high chance of twins.
Because they try to fertilize all of them. Only a few of them mature, and then from that, only a few of them continue to grow and be selected to be put into the.
Yeah. They gave her the option of putting 2 or 3, and they said with 2, if you do get pregnant, you have a more likely chance of only having 1 child. But there's also a pretty high chance of it either of them implanting. And at first she went with 2, but then she changed her mind to 3 because she said if they're already doing it there, they should just continue it. And then she ended up having twins.
With in vitro, are there any risks or downsides to that procedure?
Anything that comes with surgery.
Well, and as you age, the chance of having an actual live birth and the baby making it all the way through the pregnancy starts to decline. Over the age of 40, it's only a 6 to 10%, and under 35, it's like 35, 40%, something like that.
Well, I think you guys did a great job without slides this time. Like I've never seen a presentation at Starland without slides, and this has been really cool. I was in the HP most of the whole time, so that was really awesome. Good job.
Yeah, I guess why did you not use as many slides? Was that a requirement of the presentation?
It was more of a challenge.
Excellent. Yeah, you guys did a great job with the illustrations.
Have you done a video like that before a presentation?
Talking about the Netflix one?
No, the original one where you filmed it yourself.
We have done some other groups.
I thought it was really good how you explored a lot of different possibilities of what could have been going on, and then kind of brought it in to a more focused point of view at the end.
The list of questions that were asked to both Robert and Georgia were questions based off of the actual question list that real doctors would use.
Did you actually get to consult with real professionals in the area about this for research?
We had another couple come in though, who they have one child but they're having trouble getting pregnant again, and we have to ask them some questions. We got a lot of information from them just about the doctor things.
And then the couple told us about the medications that she used and the different procedures that she went through to be able to have this first child, and that what they're trying again with this to have the second child.
So, in a sense, you got to kind of help diagnose a real couple?
No, they were already diagnosed.
Oh.
It was,
well,
she kind of.
They still don't really know.
That's really cool that you got to do it with him.
If it hadn't been her clubbing, is that what you called it?
Yeah.
Would hormones have played a factor?
Her hormones are fine.
But if they didn't, if it weren't the clubbing, is hormones an option in increasing your odds?
It's the follicle stimulating hormone, right? That's what matures the eggs inside the follicles and ovaries.
It's a good question, because if you go back to the couple that did come in and these students got to spend some time with and just talk shop, she seems to check out very well, but for some reason her pituitary gland is not able to have a good conversation with the reproductive system, and so they're in that strange place where what do you do next when you can't get the brain to talk to the rest of the body as far as getting those hormones going.
Didn't she say that the doctor described her a drug, I think it was clomid?
You got it.
And it kind of tells her pituitary gland that it's ready, it's time to go.
Well, they have to be careful with that, because otherwise there might be too many eggs.
Yeah.
Is that something that was taken at a certain time of the cycle? Or was it a regular?
No, it was.
It was a regular prescription.
Yeah, she took like 2 a day, I think it was.
Okay.
Every day
Yeah.
throughout the cycle?
Yeah.
Can you all recall whether or not clomid was involved with their first pregnancy and
Yeah.
led to that?
The procedure they were doing is what they had a high chance of getting multiple pregnant or too many mature eggs. But her first child they used clomid to do that, and she had said that she hadn't had a period since then. So she had a child for 5 years.
Hey, audience, students, thank you so much. Fine work.